Hello, this is the coffee report for the weekend of the 23rd of May, 2026. We're going to be going over some disease updates and attempting to dissuade some misinformation going around. There will also be some political discussion as well, as unfortunately, politics impact everything, whether we like to admit it or not. First, an update on the ongoing Hantavirus situation. The main update is that the disease is doing pretty much what the virologist and epidemiologist noted it would. To refresh, Hantavirus is a highly adapted mouse virus that can translate to infection in other mammals. There is one variant that can transmit person to person during sustained close contact via air, and that is the Andes strain. People have been disembarked from the vessel, as keeping them on the ship would just keep a low level of infection and a subpopulation continuously circulating instead of limiting contact. Various countries are now coordinating through the WHO to track, sequence, and give palliative care to those infected. The disease also has an incubation period of about 8 weeks, so now the medical community is monitoring and treating. In the US, the citizens moved to the Nebraska facility are now mandated to stay quarantined for 8 weeks or until it can be proven that they are not infected. This mandate is a change from the top quarantine and biohazard facility in the US, contradicting previous inputs from NFK Jr. and his teams. Previously, the leadership under NFK Jr. stated these quarantines would be voluntary. This change in policy is due to the nature of how this disease expresses in its victims for the safety of the victims and the public. If someone self-discharged and developed symptoms at home, the disease could render it extremely difficult to contain the infection while saving the patient. So it is better to just follow the procedures and do the quarantine for the perceived 8 weeks. There is no vaccine at this time, although there have been trials. Due to some of the biology involved, the lack of urgency by the public, there's been a lag in vaccine development for this disease. This massive upswing in fear and public knowledge, however, is pushing for more vaccine research, which has been ongoing for years. There have been biological variables increasing the difficulty of producing a vaccine for this strain. There are also societal and economic reasons. As to be blunt, the demographic most impacted are more rural and lower income versus a broader risk, leading to less public interest and less funding. My fear level is a 1.5 out of 10 for the general public. Now that people are quarantining and away from being able to continuously circulate it on a ship, the risk to the gym prop is extremely low. Misinformation, confirmation bias, and confusing the boat infections with those that come from exposure to mice in the wild are more of a risk than Umbrella Corporation 1.0, the mousening. Among the people that are boat quarantining, my fear factor is a 5 out of 10. As they are being quarantined and given palliative care, their chances of survival are much greater. Also, they are much less likely to continually spread the strain amongst each other, and because of that, their risk has decreased. Now, on to Ebola. This one is sad. At this point, I'm not even angry. I'm just saddened by what has led up to this and what is continuing to happen. Sad for the victims, for the front line, sad for the public, and sad for the uninformed. For context, the region in question is in an ongoing violent upheaval, which is causing logistics disruptions and breakdowns that increase infection risk. As reported before, the slashing and defunding of USAID meant that monitoring was not in place, that supplies are not getting into the region, that testing was not readily and easily available, and that coordination in a war-torn area was catastrophically more difficult. As such, reports have come out that the failures to catch this earlier were all driven by logistical issues. Samples were tested incorrectly due to lack of reagents or limited supplies. Samples were transported improperly to more supplied regions, resulting in their spoilage for testing. Communication lines were unavailable, travel wasn't restricted, and other complications let it get ahead of the experts. The U.S. doctor that was evacuated to Europe is quarantined at a special BSL facility to see if they could be saved from making sure they aren't able to spread the infection. These facilities have airlocks, on-site incineration, special water systems, air barriers, special equipment, highly trained experts, and more to deal with making sure pathogens cannot escape. As reported by DW on the 21st, the doctor is currently fatigued but stable. The deaths have been reported by the WHO, Al Jazeera, and the BMJ to be in excess of 130, with hundreds more exposed or possibly infected in the region. WHO and other organizations have concerns for regional spread due to the instability of the area. However, risks of it spreading to the US and other international countries still remain low. Travel bans have led to individuals coming from the Congo on flights to be rerouted. Note, contrary to what some people are saying, these people were not symptomatic. They were just traveling from the regions of the world that have bans, so all flights would have to be rerouted. We are also seeing systemic issues in the region complicating the containment in this area. Ebola is a type of disease that is very stable once it's shed by the victim, so much so that it can remain virulent and dangerous even after death. Standard policies to try to save the public from post death transmission involve either sealed casket ceremonies or cremation before the victim's remains are turned over to the public. The burial must be done in a way that ensures that there is no exposure to the remains. Unfortunately for the grieving's safety, mourning practices in the region conflict with safety protocols. This has led to frustration, anger, and misunderstandings as the public becomes more frustrated and scared. Also, stop me when this sounds familiar. The people in the region do not all have a good understanding of how the virus works. Many have been told it is a plot or it isn't real, or that folk remedies can protect you. Sound familiar? This distrust in scientists and experts has led to clashes, in this case resulting in a facility being burned down and patients fleeing back into the population. It was reported by the Associated Press that a center was burned down in a clash due to the growing anger and misunderstandings on the 21st of May in the Congo. Local authorities were trying to treat patients but also make sure victims who had passed could not infect their relatives. During this, friends of one of the victims who were trying to retrieve their loved one's body grew violent after being denied. As the official numbers reflect that what has been tracked, the poor infrastructure, lack of supplies, and the ending of the USAID program means that the full reach of this disease in the region is expected to be much higher by experts, but they don't have the supplies to test. This leads to the regional risks near the initially reported areas to be declared extremely high. However, travel bans, logistics, how the virus spreads, means that the further you get from the area, the lower the risk to public health it becomes. The risk for locals is extremely high, but for places like the US, Europe, and Asia, the risk drops down considerably. As this plays out, a partnership between Oxford scientists and the Serum Institute of India are working on an extremely fast track technology to develop a vaccine. This process relies on development protocols refined during COVID to quickly trial vaccines into pipeline materials into mass production. This process uses ChAdOx1 as a vector to hold enough virus so that the antibody creation systems can detect the disease and make appropriate countermeasures. This is done within animal models to the specific way those immune systems will react, making the components needed to make the vaccines. Note, this protocol is tested and very fast, but even if they hit everything out of the park on the first pitch, it will take months to get this deployed where it is needed, so don't expect it in the next few weeks. We need to support the WHO and the aid workers in the region while working on fast-tracking technologies like ChAdOx1 and 2 to deliver vaccines. For more information, see the above-linked articles. Thank you. Since I gave an anxiety level for Hantavirus, I feel obligated to give another one for the above as well, with caveats to help give context. For fear of person-to-person widespread transmission of the strain of Ebola in Europe, Canada, Asia, and the US, it's at a 0 to 1 out of 10. Logistics, transmission vectors, travel, and more make this less likely. For fear of person-to-person widespread transmission of this strain of Ebola in the Congo and the surrounding regions, I'm at an 8.5 to 9 out of 10. Methods of prevention and tracking were defunded, making healthcare workers strapped for supplies in the region. This is going to be scary and bad for the region. That is why the WHO raised its regional concern level to very high, while maintaining its lower international concern. For those who wish something to do to aid, I recommend putting pressure on your country's governments to fund supplies and aid workers. They are extremely undersupplied, and it was politics that caused that. So screaming at politicians should be cathartic, as it's part of their job description to get yelled at by the public anyways. Doubly cathartic if we can get supplies flowing. Keep yourself educated and informed, and do not let social media pundits spike your fear levels. Remember, look at the source, look at their citations, look at the further readings. Again, as with all of my reports, do the like, comment, and subscribe thing, and thank you for your time.